on medicating our kids.
In his 10 short years, Robbie Erbs has spent 4 of them medicated. He's now on the antidepressant nortriptyline. Drew Roberts takes Ritalin, and Scott Visacki is on Catapres and Norformin. The truth is, these kids are a sign of the times.
About 6 million psychiatric drug prescriptions are written every year for kids under the age of 18. Ritalin use has doubled in the last 6 years.
The parents think the medications allow their children a normal life when it otherwise wouldn't be. Karen Roberts says the signs started early.
I just always thought he was a very energetic little boy, just rambunctious all over, into everything.
In the olden days, Drew would have been known simply as a hyperactive boy, but now we have a medical diagnosis, attention deficit disorder, and he's very aware of what that means.
One day we had a test right after recess, and I couldn't settle down, and I had trouble thinking and stuff. I can just concentrate on one subject.
Most doctors agree when used correctly for the right people, drugs can be a help. But according to Dr. Howard Gollup, there are pitfalls.
Sometimes the allure of medications is that it may represent sort of an easy and perhaps quick fix, that they would abandon some of the hard work and some of the psychological modalities.
Dr. Gollup worries about overuse for borderline cases or choosing drugs when other strategies might work just as well.
There's sometimes a tendency to fall upon the medication as a crutch.
That's why Peg Erbs makes sure she and her son work on other strategies for dealing with his problems in addition to the drugs.
Continually link cause and effect with the kids rather than do your homework, do your homework, do your I told you to do your homework. You would say, how are you going to feel tomorrow when your homework isn't done?
Robbie also has to break tasks down into smaller parts, but he's glad to have the medication.
I'm not wild and stuff, knocking things over. Just settle down.
Everybody knows what team they're on?
Kathy Emmerich's been teaching for more than 2 decades, so she's witnessed firsthand the move toward medicating. While it's still not her first choice, she feels that medication does have a place.
It does help the children to focus. It does help them to stay on task and to do the best that they can do.
It's not just attention deficit disorder that's putting kids on drugs. Scott Visacki has a variety of problems, including compulsive obsessive disorder. His parents fought medications for a long time.
Definitely didn't want a child that was a zombie, which might have been easier for us to take care of, but really wasn't fair to the child.
As Scott's problems intensified, they decided to give medication a try, and now Scott takes antidepressants.
When he's on the medications, he's just more social, more likable, and less challenging.
Perhaps less challenging, but no matter what problems kids face, parents, teachers, and doctors agree medication alone can't be the quick fix. For the Night Team, Ann Ballantyne, today's TMJ4.
And Daybreak will have more on this story tomorrow.
John's with us now, and some good news about the temperatures we're expecting.